Schneid guy.
So here's the feedback control diagram. It's a lot of elements here, but let's try to break it down step by step. So if I start with map, which is the controlled variable, I see there's a positive relationship on baroreceptor stretch. After all, they sense stretch. Carotid sinus and aortic arch are listed here. And notice that there's the afferent activity from cranial nerves 9 and 10 going into the medulla. Again, these are positive signs, positive relationships. And the medulla cardiovascular control center is going to have a negative influence on the sympathetic nervous system and a positive influence on the parasympathetic nervous system. And it's going to be at the level of the preganglionic neuron. Now, if we go and look at the different relationship between these elements, we see that the parasympathetic preganglionic neurons have a positive relationship on the parasympathetic postganglionic neurons. Of course, it's acetylcholine activating NN receptors. Parasympathetic preganglionic neurons have a positive relationship with postganglionic neurons, and the sympathetic preganglionic neurons similarly have the same relationship because they're using the same acetylcholine and NN receptor. Now, if we look at the SA node firing rate, we see that there's a different effect of the parasympathetic postganglionic neurons versus the sympathetic. I have acetylcholine, which is going to be acting on the M2 muscarinic 2 receptors, which has an inhibitory effect on the SA node firing rate, but the norepinephrine released by the sympathetic nervous system activating beta 1 adrenergic receptors has the opposite effect. It's going to have a positive relationship. And the SA node firing rate, if it goes up, heart rate goes up. If SA node firing rate goes down, heart rate goes down. So that is a direct relationship. Also, I want to point out that the AV node conduction, which is another electrical effect, there's a negative effect of acetylcholine on the AV node. Similarly, the sympathetic system also does effect on the AV node as a positive relationship. But I'm just pointing out this here because this is not part of the feedback loop. The AV node conduction is not going to have any effect on the blood pressure, but it is an electrical effect that does happen with this baroreceptor system reflex. If I go and look at the ventricle inotropic state, I have sympathetic nervous system having a norepinephrine release on beta 1, increased inotropic state, and if sympathetic system goes down, the inotropic state goes down. And there is no parasympathetic effect on the ventricle, so we're leaving that off. If I go and look at the effects on stroke volume, the inotropic state does have a positive influence on stroke volume. If you contracting more forcefully, more blood is going to leave. If you contract less forcefully, less blood is going to leave. So that positive relationship makes sense. And then for heart rate, there is a negative influence on stroke volume because of the effects on filling time. Now, if we go and look at the cardiac output, remember, is the product of the heart rate and stroke volume. So these both are going to have a positive influence on the cardiac output. Now we move our attention to the vasculature. I see that arterioles and veins have alpha 1 adrenergic receptors that are activated by norepinephrine. So more sympathetic, more constriction, less sympathetic, less constriction. Now, what's the effects of the constriction in these locations? Well, when the veins constrict, that causes the venous return to go up. When the veins relax and pool blood, they decrease the venous return. So that's a positive relationship. And for the arterioles, remember they're inversely related to the resistance, to the fourth power actually. And if the arterioles constrict, I get an increase SVR. And if the arterioles dilate, I get a decrease in SVR. Okay, why does I have the venous return here having a positive influence on stroke volume? Well, that's because the venous return is going to be related to cardiac output, as we mentioned before. Because of its steady state, those are going to be equal. And there's a mechanism called the Frank-Starling mechanism that when you stretch the ventricle ejects more blood. So if I have more blood coming back to the heart, more stretch, more stroke volume, that'll give us more cardiac output. If I have less venous return and less stroke volume, then I have less cardiac output. So that is all how that's tied together. Now if I go and look at the map, remember the map is going to be directly related to the SVR, which is shown here, and the cardiac output, which is shown here as well. So now this is the complete feedback loop showing you that in general, when the map goes down, if you work all this out, you see that the sympathetic system gets activated and the parasympathetic system gets turned down. And the reason why that's important is because that's going to help stabilize the blood pressure and bring the blood pressure back towards normal. If the blood pressure goes up acutely, you get the opposite effect. I just want to point out one thing I have written here is standing. This is a normal response to the baroreceptor reflex. When you stand up, that is going to have an effect from gravity to decrease the venous return, decrease the stroke volume, decrease the cardiac output, decrease the blood pressure, and that's going to then decrease the stretch of these arterial baroreceptors, which is going to have less of this input going to the medulla, and then the sympathetic system is going to be turned on, the parasympathetic system is going to be turned off, and that in general is supposed to restore your blood pressure back close to normal. Now, when there's a failure in this system to work, you get something called orthostatic hypotension. And the main considerations there when you're talking about receptors is that the alpha-1 receptors, when they're blocked by drugs, for example, that is a very important cause of this orthostatic hypotension, because the alpha-1 receptors probably play the most important role in raising the blood pressure in response to a reduced MAP. And when that receptor is blocked, you remove an important component of this feedback control system.